Good afternoon, everyone. Our topic is all about mandibular nerve blocks. And what is mandibular nerve block? Mandibular nerve block means that the nerve pulses coming from the mandibular nerve is blocked by local anesthesia. Usually, the nerve block means the LA is injected or deposited in the larger main trunk to block the nerve impulses. Coming to the main topic, we are discussing about the mandibular nerve. Then, what is the course of the mandibular nerve? Mandibular nerve is the branch of trigeminal nerve that arises from the foramen ovale. It has two roots, that is a large sensory root and it has got small motor root. And the sensory root arises from the trigeminal ganglion, whereas the motor root arises from the motor cells that located between the pons and the medulla oblongata. And both these roots arise separately in the cranium, and it travels through the foramen ovale. And coming to the branches of the mandibular nerve, it has got three main divisions. That is, first one is the branches of the undivided nerve, that is mainly nerve to medial pterygoid and the nerve to spinosum. And the second division is the branches of the anterior division, where there is the nerve to lateral pterygoid, buccal nerve, deep temporal nerve, and mesenteric nerve. Then coming to the posterior division, there will be inferior alveolar nerve, then the auricular temporal nerve, then the lingual nerve, mental nerve, etc. Then coming to the nerve supply of the mandibular teeth, there is the incisive nerve, the pulp and the investing tissues are supplying to the anterior teeth. And the inferior alveolar nerve, the long buccal nerve and the lingual nerve. Main supply of the lingual nerve is in the lingual buccal mucoperiodontium, while the long buccal nerve it's about the buccal mucoperiodontium. Inferior alveolar nerve, they're supplying to the pulp and investing tissues of the premolar and molar teeth, when the incisive nerves, the supply mainly to the anterior teeth. Then coming to the main blocks that in the mandibular nerve, yes, intraoral technique and extraoral technique. Intraoral technique is really closed mouth technique and open mouth technique, and extraoral technique is there. Intraorally, closed mouth technique is Vasaroni Akinosi, and open mouth technique, that is Fisher's 1, 2, 3 technique, in direct technique, and the direct inferior known as class inferior alveolar nerve technique. Then the extraoral technique is Kurt and Thomas technique, mandibular nerve block, mental and incisive nerve blocks. Then coming to the block of the terminal branches, the nerves anesthetized by blocking the terminal branches are the terminal branches of the nerves. Areas anesthetized, areas innervated by the terminal branches, and indication is useful in giving successful block in the anterior teeth. And then techniques mostly known as parapedostal or intraosseous techniques. Then coming to the mandibular nerve block, that's one of the main block in the anterior region. The nerve anesthesis is the mental nerve. Areas anesthesis is lower lip, mucobuccal fold of the anterior to the mental foramen. And the main anatomical landmarks are the usually between the mandibular bicuspids. And the main indication is there the procedures when there is a manipulation of the buccal soft tissues anterior to the mental foramen is necessary. Then these are the areas anesthetized by the mental nerve block. Usually the mucobuccal periodontium. Here the mental nerve block is not blocking, not for the teeth, it's only for the buccal mucoperiodontium. The pulp and the investing pulp tissues are mainly blocked by the incisive nerve block. Then coming the technique, the main technique is to identify first, we have to identify the mental foramen that lies below the apex of the, usually between the two apex of the premolar or between the first and second premolar. Then after the identification of mental foramen, a 25 to 27 gauge short needle is usually recommended, and the orientation of the bevel should be placed towards the bone, and depth of the penetration is about 5 to 6, and deposit over 0.6 ml over 20 seconds. Main symptoms are tingling and numbness of the lower lip, and main advantage, there is no loss of sensation. The main complications are hematoma and partial paresthesia of the lip patching. These are the mental nerve block. This picture depicts the existing of the mental nerve and identify the mental foramen, and LA is injected. Then coming to the incisive nerve block, the nerve anesthesis is incisive and mental nerve. Areas anesthetized same as the mental nerve block, but here the cuspids, cuspids at interiors incisor teeth are anesthetized, and in the mucobuccal periodontium, also anesthetized. Then coming to the anatomical landmarks, as we have already mentioned that it is same as that of the mental nerve block. Usually, you have to identify the mental foramen that usually located between the bicuspids, and is usually indicated in the cases where the structures anterior to the mental foramen. At 27 gauge short needle is recommended. An area of insertion is about the mucobuccal fold at the anterior to the mental foramen. Target area is mental foramen, mental nerve axis inside where the incisive nerve is there. Then the landmarks are the mandibular premolars and mucobuccal fold, and the depth of the penetration of the needle is about 5 to 6 millimeter, and slowly deposit over 0.6 ml of local anesthesia in over 20 seconds. Then same as that of the mental nerve block, incisive nerve block, the signs and symptoms are tingling and numbness of the lower lip, no pain is felt during the procedure, and complications like hematoma and paresthesia of the lower lip and chin. Coming to the classic inferior alveolar nerve block, it is always known as mandibular nerve block, and it is useful in the technique of quadrant dentistry. Usually, inferior alveolar nerve block is as a supplemental injection of buccal nerve block is given when there is we have to extract the mandibular molar area, because the soft tissue anesthesia is mainly by the buccal nerve. The nerve anesthetized by the inferior alveolar nerve, incisive nerve, mental nerve, and the lingual nerve. The areas anesthetized. In this picture, this clearly depicts the anterior two-third of the tongue, the mucobuccal periodontium, anterior to the mental foramen, the pulpal anesthesia from the molars to the incisor region, lingual soft tissue and the periodontium, etc. Then coming to the technique, a 25 gauge long needle is usually recommended for inferior alveolar nerve block. Area of insertion is mainly mucous membrane on the medial side of the rhombus, and there is a two lines are intersecting. The inferior, that is the horizontal line and the vertical line. Horizontal line representing the height of the injection, whereas the vertical line representing the anterior posterior plane of the injection. The target area is a inferior alveolar nerve as it passes downward for towards the mandibular foramen, but before that it enters to the mandibular foramen. The main landmarks are the coronoid notch, pterygomandibular raphe, occlusal plane. All these three are the landmarks for the inferior alveolar nerve. But its coronoid notch can be identified by a greatest concavity that can be palpated on the anterior border of the rhombus. Then coming to the procedure, the three parameters has to be considered. That first one is the height of the injection, second one is the anterior posterior placement of the injection, and third one is the depth of the injection. First, the height of the injection. Place an index finger or the thumb finger on the coronoid notch, palpate the coronoid notch. An imaginary line is drawn from the fingertip of the coronoid notch to the deepest part of the pterygomandibular raphe. Here, from the deepest part of the pterygomandibular, it usually turns vertically upward towards the maxilla, and this determines the height of the injection. This imaginary line should be parallel to the occlusal plane of the mandibular molar teeth. Then, second parameter is the height of the injection. Notice the placement of the injection valve at the corner of the mouth, that is usually on the corresponding to the contralateral premolars. The needle insertion lies in 3/4 the anterior posterior distance from the coronoid notch to the deepest part of the pterygomandibular raphe. Then the anterior posterior second parameter is the anterior posterior diameter. Then here, the needle penetration occurs at the intersection of 2 points. The point 1 that falls on the horizontal line. In this picture, you can use horizontal line from the coronoid notch to deepest part of the coronoid notch, deepest part of the pterygomandibular raphe, and the second point is the vertical line that is about the 3/4 the distance from the anterior border of the ramus. Then this determines the anterior posterior site of the injection. Here is the anterior posterior site of the injection, inferior alveolar nerve block. Then coming to the penetration depth, the bone must be contracted, and average depth of the penetration is about 20 to 25 millimeter, approximately 2/3 to 3/4 of the length of the long needle. Then, if there is bone's contact is too soon, withdraw the needle and bring the syringe barrel towards the front of the mouth and redirect the needle until more appropriate depth of the insertion is obtained. And if the needle is located far anteriorly, then also we have to withdraw the needle from the tissues and bring the syringe barrel anteriorly toward the lateral incisor or canine. Usually between the premolars, bring the needle towards anterior to the lateral incisors or canine and reinsert to the proper depth. Then if there is over insertion and no more bone is contracted, then also withdraw the needle from the tissues and, reposition the syringe barrel over the premolars and then reinsert. When the bone contact is felt, approximately 1 millimeter to prevent the subperiosteal injection, aspirate in 2 planes, and 1.5 ml over 60 seconds should be given. Slowly withdraw the needle. Half of this length remains within the tissues and give a lingual nerve block. We aspirate in 2 planes and deposit the about 0.1 ml to anesthetize the lingual nerve. Approximately after 20 seconds, ask the patient to sit upright and wait for 3 to 4 minutes and start the procedure. While I'm giving the after giving the inferior adrenal nerve block, usually buccal nerve is accommodated with that. It is anesthetic, but the buccal nerves are buccal soft tissue and the mandibular molecus nerve. Same as the nerve, we are giving buccal nerve block, then buccal nerve, that is a branch division of the mandibular nerve. Then a 25 gauge long needle is taken. Area of insertion is the mucous membrane distal to the buccal and to the most distal molar tooth. Target area, buccal nerve as it passes through the anterior border, and landmarks at the mandibular molars. Always orient the bevel towards the bone. Then direct the syringe towards the injection site. Depth of penetration is about 2 to 4 millimeter and slowly deposit 0.3 ml. And the main signs and symptoms, usually when we give the buccal nerve block, the patients rarely experience symptoms. The objective signs is no pain felt during the procedure. And thank you.